Hello, and welcome to Care Coordination in Spinal Muscular Atrophy. This is the third podcast in a three-part series titled New Therapies, New Considerations, Supporting Comprehensive Coordinated Care in Spinal Muscular Atrophy. I am Dr. Julie Parsons, co-director of the Neuromuscular Clinic at Children's Hospital, Colorado. Joining me today is Dr. Vanessa Battista, Senior Nursing Director and Pediatric Nurse Practitioner at Boston Children's Hospital. This program is supported by an educational grant from Biogen. Partners for Advancing Clinical Education is providing this activity for 0.25 ANCC and AAPA credits. To receive your credit for this program, please go to practicingclinicians.com/SMA3. I'll repeat that link for you at the end of the discussion. Today's learning objective is to identify strategies to better coordinate care of patients with SMA within multidisciplinary teams. So let's dive in. Vanessa, we've had amazing new therapies for SMA as discussed previously. However, we know outcomes are improved by using care guidelines and care considerations. Could you comment on their importance and how we should incorporate them into practice?
Yes, sure. I'd be happy to. Thank you. There really is so much more now that we can offer families, given that we have these amazing new therapies that we discussed in our earlier podcasts. And we've seen the field come such a long way in being able to not only develop, but be able to offer these therapies clinically to these young patients. And that's an amazing thing, but we also know that there's so much more to the treatment and care plan now than just these different therapies and medications. It really is the whole picture of how we provide care. And I think so much of this really depends on the interdisciplinary team. So while the neurologist is often the most important person in making a diagnosis and meeting a family and explaining things to them and offering medications and treatment options, we also know now that there are other members of the team who have always been crucial, but are even more crucial now to the treatment of these individuals. So we need to take care of all of the components of the child. And this involves not just giving them their medication, but keeping up with all of their therapies. And when I was saying about the members of the interdisciplinary teams a moment ago, I was thinking about really the physical therapists and the occupational therapists. And sometimes our individuals living with SMA that we meet are also seeing speech therapists. They may have, if they're younger children, they may participate in play therapy or different kinds of therapies, perhaps at school, but really having PT and OT or physical therapy and occupational therapy involved is crucial. Giving medical treatment, giving one of the three medications that we discussed earlier is very important, but without these other therapies being incorporated into the plan of care, we know that children won't be as successful. So we need to give the medications, but to also keep them stretched appropriately, doing whatever exercise and therapy they're able to participate in, and really working on all of their the components of their lives. So we know that these are treatments and they are not a cure. We hope that one day we will have a cure, but right now these are treatments, which means SMA doesn't go away. And so in order to keep people functioning at their best, we need to continue therapies. The other one that comes to mind that I didn't mention is aquatherapy. Many of our patients and families participate in aquatherapy, which is a great way to get people moving in the water. And so it's just really important to make sure that we still take care of all of the parts of someone who is living with SMA. And while we're very grateful that these therapies exist, we know that we can't just give treatment and not pay attention to all of these other parts.
I completely agree with you, Vanessa. And I also think that while we want to treat kids early, that we aren't expecting kids to be typical. So we still have babies that are weak. They have respiratory difficulties. They're fragile. Some of them have feeding and eating difficulties. So having our pulmonologist, having our nutritionist really help to provide the best care for patients is foundational. They're little kids that need immunizations like everyone else. So having a primary care provider that's really invested and educated about the disorder is also key. The other thing that's really interesting to me is that we know we're making a difference with these therapies, but we really don't know what the patients will look like in the future. So continuing to come in and have multidisciplinary evaluations to look at these children going forward to see what kinds of new medical issues might be developing over time, I think is key as we look to the future, look to other therapies.
Absolutely. I think of it really as just trying to give kids the best chance that we can at doing as well as they possibly can. So doing as much as you can to just enhance their well-being is really the way to go.
Absolutely. And we know that the patient's quality of life is improving. Because of this, interestingly, one transition we're seeing more often now is that shift from pediatrics to adults. What can you tell us about how to best manage transitional care?
Yes, this is certainly, a new problem, I think, for us, but a good problem to have. When I use the word problem there loosely, but we never had to really think about transitioning from pediatrics to adult before in the way that we do now, given these treatment options and children living much longer. The main point I would want to make about transitional care is that transition is a process. It's not one point in time. So it doesn't happen at one visit. It doesn't happen one time only. It doesn't involve just one conversation. According to guidelines that are out there, it should really begin at age 11 or 12. Really, 12 is probably the magical number that's used. And that's to start having that conversation, to start to prepare both the individual, the child or adolescent who's going to be transitioning, and their family. There's lots of components to this, right? There's the piece of actually transitioning the medical information and making sure that all the records and all the things that someone needs to know on the adult side happens. It's also making sure that the family is ready to do this, both not only from the physical piece of it and all of the medical components, but emotionally, right? They may have spent their entire lives thus far being cared for by the same team in a pediatric center, and it can be very scary to think about transitioning over to a new team of care, or a new care team. And so we want to think about this as really a process that happens over time. Many programs have sort of systems built in or models built in where they break this up over a certain number of visits over time. They do readiness assessments. They work with often a social worker or someone on a team, perhaps a nurse practitioner. I know I did a lot of this work in our clinic, and really just preparing that family. And then the other big piece is having a partner on the adult side. So it works very well when you have a center that you can transition patients and families to directly. I realize that not everybody has this. Not everyone's working in a system where they have a pediatric and an adult center nearby that has neuromuscular care available. But even if it's not in the same physical location, just identifying a team that you can reach out to as providers and get that information to them and help make that transition smooth. So it's sort of someone that's doing an intake on the other side to connect on giving information and assuring the family that you have a contact there and can make that transition as smooth as possible. I think one of the other things we think about now really in this transition is families are often nervous about this and fearful, but there are so many issues that need to be dealt with in the adult world, and they really deserve to be in adult care for that. We are thinking about things now, especially with all these treatment options, things like pregnancy and people with SMA having their own children. And those are things that we really need to consider treatment and specialists in the adult world that can help address these issues. So we may start to address them on the pediatric side, but we really want to make sure that we do that at the right time so that people can get the care that they deserve.
I completely agree. Very, very important to have that support for the patients and their families over time. What role does shared decision-making play in the management of SMA and improving care communication?
So this is sort of a huge question, I think, but when we think about shared decision-making, the decisions are shared among a lot of people, right? We may be thinking about the family as the unit who has to think about decision making. Does it involve the child? That depends on their age and their developmental ability to participate in making a decision. Does it involve parents or other caregivers, right? We know now it's not always parents who are guardians, maybe other family members. There may be extended family members who are involved in decision-making. There may also be decision-making that involves members of the healthcare team, right? They're always asking for sort of our expertise and our input in thinking about decisions regarding the management of SMA, especially now that we have treatment options available. I think one of the first questions families ask us is, what do you think we should do? Or what's the best thing to do? Or what would you do? And so I think it's really important when we think about communication to make sure we understand who that family needs to include in decision making and who they feel is important to be involved in decision making, and to make sure that we do ask children when it's appropriate to do so. One thing about SMA is that because people that are living with SMA may appear to have a physical disability, although now that's even less and less given the treatment options, but sometimes people make assumptions about their intellectual abilities. And we know that there is no impairment in intellectual abilities in people with SMA. And so we want to make sure that when we're having these conversations and making these decisions, we're either including the child or the adolescent or the individual, whatever age they are, who has SMA, and also that we're not talking about things in front of them as if they can't understand us and don't know what's going on, because they certainly do. So I think it's just important to make sure we let people in the community know and understand that about SMA, that people are very capable intellectually and can function very well and very highly, and just like any other individual in that regard. And so we want to make sure that we're dealing with any misconceptions around that, and including all of the people who the family wants to include when making decisions.
I think that is so important. I absolutely agree with you. I also think a part of the decision making is having the knowledge, having the education, and helping to manage expectations. As you said previously, all of these wonderful treatments that we have are not cures, they're treatments. So patients still have SMA and they can go forward with their lives, go to college, have very fulfilling adult lives at this point. I think that's very, very exciting. But they may not be typical and they may still have some issues. So managing expectations going along with what decisions they're making, I think go hand in hand as well. So thank you, Dr. Battista, for talking with me about this important topic. And thanks to everyone for listening. To claim your credit for participating in this activity, please go to practicingclinicians.com/SMA3 and complete the post-test. Again, that's practicingclinicians.com/SMA3. Thank you. I also invite you to listen to the 2 additional podcasts in this series where we discuss early diagnosis and medication therapies. Thank you again for joining.